Okay. So, first and foremost, like we heard with the Danny Gans video or the Danny Gans taping, your 911 operator is going to say, get the person on the floor if you can, as long as they have not had any neck trauma or trauma to the head and they're lying there in bed, bring them to the floor. The main reason why we do this is we want the blood to be able to get to the head. If the bed is elevated, if there's pillows under the head, you're going to have a negative gravity effect. So you want to get blood to the head. So we get the patient on the floor right away. Plus, it's very difficult to do chest compressions on somebody that's on a soft surface. And a water bed, especially if it's a water bed, I don't know where the blood from the chest compression is going to go. So you want to get them on the floor, and don't be putting pillows. Don't be worried about if their head is going to be hurt on the tile. Get them flat. That head has to be flat. Okay. And of course, if there's no response, you call 911. Calling 911 is imperative. Now, sometimes they say with kids, you're going to give them a couple breaths and then call 911. What I tell everybody to do is have a phone with you at all times. My cell phone is with me wherever I go, even when I go into the bathroom, which means some of you that I've actually texted on the toilet. Sorry, but I have my cell phone with me at all times. You should have a phone with you around you at all times. Plus, I'm going to say, I want you to have a phone that has a speaker component to it. When you listen to the Danny Gans 911 tape and you listen to the wife, she sounds like she's doing the chest compressions perfectly. She has one hand over the other. I'm going to tell you how to do that. And you hear her counting, but she is speaking so clearly into the phone. So I'm wondering if somebody was holding the phone for her. If you aren't lucky enough to have somebody hold the phone next to your ear so you could be listening to the 911 operator give you instructions, I want you to have a phone that's on speaker. So if you have a phone in the bedroom that's not speaker, I want a speaker phone right away, okay? All right, so you get them on the ground, you call 911, you tilt the head back and you listen for breathing. Now, if you can't listen or hear the breathing, because sometimes they'll hear sometimes if they're in pulmonary edema or they're getting or heart failure, they'll have some fluid in their lungs. So you'll be able to hear some gurgling. That doesn't mean they're breathing. And if you can't hear anything, after you tilt their head back, you have your cheek very close to their mouth to see if you could feel the breathing. Okay. And you check for a pulse. The carotid pulse is in the neck, and you're going to see this on the pictures on the website. But if you can't feel a pulse and they're unresponsive, the 911 operator is going to tell you to give 2 breaths and start CPR. Now, to give 2 breaths, your mouth needs to form a complete seal over the adult mouth. On an infant, your seal has to be nose and mouth. So your mouth is going to have to go over the nose and the mouth at the same time. But when it's an adult, you'll have to make sure there is a seal. And you're going to give 2 breaths. And each breath should take about 1 second. Okay? Now, if the victim is still not breathing normally, all right, and I'm going through these instructions with you as slow as I can, you're going to begin the chest compressions. Now, what you do to find the chest compressions is you find the nipple line and you go right below that and you put one hand over the other. Now, I know a lot of people are thinking, well, my mother-in-law's nipples are, below her knees now. All right, guys, use some common sense, okay? If, your wife has had 3 kids and her breasts are not in the correct position, then just imagine where the nipples would have been when she was in her 20s, and that's where you're going to start the chest compression. You put the heel of your hand in between the nipple space in the center. You put another hand over it, okay? And then you are going to be starting to do compressions. And people go, oh my God, how far do I push? Well, we say 1.5 to 2 inches if you can, all right? 1.5 to 2 inches. And you are going to be doing these compressions at a rate of 30. Actually, you're going to be doing the compressions at a rate of 100 times a minute, but we tell people to do a series of 30 pumps per 2 respirations. All right. So you're going to be pumping 30 times, and then you're going to give 2 rescue breaths. Go back and give 30 compressions. So now there has been some controversy that came out about a year or 2 ago where people are screwing this up. They don't know about giving the breaths. They're messing it up. They're stopping the compressions. So if you're confused, just continue to do the compressions. Now, what has helped is a song. And this actually I think I heard this on Mark and Mercedes a year or 2 back, where they did a study and they found out that one of the perfect songs to do chest compressions to do is Staying Alive. And Jim's going to play Staying Alive for us in just a couple minutes. Now, the Staying Alive has the perfect beat. So if you can't remember this 32 stuff that I'm telling you, 30 compressions, 2 beats, 2 breaths, you do it to Staying Alive, okay? And we're going to get that song out for you. Oh, I love this song. Okay, you guys hear that beat? All right, so you're going to be going 1 and 2 and 3, and maybe I'm not exactly right on the beat, but you are going to be doing the chest compressions to that beat, okay? Staying alive. And that's so easy to remember. Oh, that's great. Thanks, Jim. That is wonderful. Now, they said another song is Another One Bites the Dust. Another One Bites the Dust from Queen. You know, another one bites dust. All right, that song also works, but again, that's a little bit more morbid, so we'll stick with Staying Alive. All right, we have Sue on the line. Sue, welcome to the Dr. Daliah Show.